Good evening. Hello, everybody. My name is Tony Barriant, and I'm the Director of Member Services and Chapter Development for the Hearing Loss Association of America. I'm going to be your moderator this evening for Dr. Bratt's web chat. The Hearing Loss Association is proud to present live moderated chats featuring nation's leading experts in hearing loss and hearing loss issues. And for those of you who are visiting the web chats before, you'll notice that tonight is quite different. This is an exciting format. You see our guest speaker on webcam, and you see me as well. Hello. You will enjoy a short presentation, and of course, this event is entirely captioned for your benefit. This evening, our topic is Audiology and Hearing Aid Benefits for Veterans. Our guest speaker is Dr. Jean Bratt from the Veterans Administration in Nashville, Tennessee. For those of you who attended the Nashville Convention last year, you had the opportunity to hear Dr. Bratt speak at the opening session. Dr. Bratt is the Chief of Audiology and Speech Pathology Service at the Department of Veterans Affairs, Tennessee Valley Healthcare System in Nashville, Tennessee. He received his doctorate in audiology from Vanderbilt University in 1980 and has since been a clinical audiologist at the VA in Nashville. He's also an associate professor of audiology at Vanderbilt School of Medicine, where his teaching interests have centered about clinical audiology and pathologies of the auditory system. Dr. Bratt will speak to you, and afterwards, he will take your questions. You can type your questions in the chat box in the middle, on the left, on your right, on your left column. And you can see where you can enter your questions. Below that, you will find that there are documents you can download. One is Dr. Bratt's presentation, and two of them are in Acrobat format that is universal, that anybody can should be able to open, and you can write notes. You can find that under the chat box. So now we're here to welcome Dr. Bratt. We're very honored to have him come and be our guest speaker in our new chat room and spend time with our members and veterans. Thank you so much for coming, Dr. Bratt.
Well, thank you so much, Tony. It certainly is a privilege for me to be with you tonight, and I want to thank you so much for the opportunity. It was a real privilege also in Nashville to meet so many members at your excellent meeting, and tonight it's also an honor for me to be able to speak on behalf of the Department of Veterans Affairs and hopefully to provide some assistance for benefits, particularly with regard to hearing loss for our hearing impaired veterans. And again, thank you so much for the invitation.
Okay, so I guess it's time to get started with your presentation. And so, Dr. Bratt, I again give you the mic.
Thanks again. I have prepared a very short presentation just to give you some background on the VA hearing program, and also to provide for you an email address. And I welcome any comments or questions that you have. A few of you have sent in questions today that I'll be able to begin with, but also through my email address, I would be very much interested in hearing from any of you who have more questions, or if you want clarification on any of the things that we spoke about tonight. So I've included my email address on the opening page of this presentation. And now I'd just like to move through 3 or 4 pages just to give you some background to the program. And then after that, I'll be happy to take any questions that folks have. The VA audiology program is centered, I think, around the provision of hearing treatment for veterans with hearing loss, particularly with regard to hearing aids. But it goes well beyond that. As you can see from this list of services provided by the VA, we also, in addition to just evaluation and treatment of hearing loss, have programs for the evaluation and management for tinnitus, or tinnitus as some folks wish to say. We also have a very active program in the assessment of balance problems, and in some locations also balance rehabilitation. We of course evaluate our patients and issue hearing aids and other assistive and alertive devices to veterans who are eligible to receive those services. For those individuals for whom hearing aids are not appropriate, particularly for those with severe to profound hearing loss, or for those typically with conductive hearing loss who cannot wear a traditional hearing aid, we also have a cochlear implant program, and we also provide bone-anchored hearing aid management, or sometimes more commonly referred to as BAHA, B-A-H-A. Finally, many of our sites also have active programs in oral rehabilitation for hearing loss. And so you can see that the services that we provide are quite varied and cover the gamut. Now, some of the VA sites across the country are located in large medical centers, and typically you'll find the complete array of services just mentioned. In other instances, maybe nearer to a smaller site, and in those instances, the complete gamut of services may not be available, but typically the availability of those services may be provided at a larger VA medical center within driving distance, or may be provided in certain circumstances by the VA and arrangement in which patients are private providers at the expense of the VA. Now, this is a rather busy slide, and I apologize for the small type, but basically I wanted to just briefly go through the hearing aid program itself. I believe that it's fair to say that the program itself is recognized for its excellence because VA audiologists are fortunate to be able to use state-of-the-art instruments, and I think are highly skilled professionals. Typically, the initial hearing aid is provided free of charge, or as we prefer to say in the VA, all of our services are prepaid by years of service, and I mean that in the fullest sense of the word. Also, if in some instances a backup hearing aid is necessary, they may also be provided. The evaluation includes the fitting and adjustment of hearing aids, instructions on the use and care of hearing aids. Typically, the hearing aid batteries are provided through the mail, again, at no added expense to the veteran. And all hearing aid repairs are also provided at no added expense, either through the local VA medical center or through an extensive mailing program that the VA has established through its main depot in Denver, Colorado. Typically, hearing aids are expected to last somewhere between 4 to 6 years of age, then may be replaced, or they can be replaced sooner if the hearing aid is lost or if there's been a significant change in hearing. And also the range of assistive listening devices is quite extensive, ranging from alerting devices and other types of signalers to FM systems, to infrared systems, to assist veterans in different types of listening situations or living situations in which they need additional help. Sometimes VA may find itself using contract hearing aids and off-contract hearing aids. Typically, most devices that are provided by the VA are provided through 8, 9, or 10 large manufacturers who provide hearing aids to the VA on contract. But sometimes it's necessary when the needs are quite specific to go off contract, and we certainly have that ability to do that as well. So I think you can see that the program has been designed over many years of service to provide the best opportunities for veterans to receive the services that they need with a minimum amount of inconvenience to them. I think probably one of the most important questions that you may have tonight is simply this: who is eligible in the VA to receive hearing aids? And I've listed probably the 8 to 10 most common eligibility criteria for receiving hearing aids through the VA. But again, if you have specific questions, I would really encourage you to contact me at your convenience through my email address if you have specific questions. Generally speaking, however, any veteran may receive a hearing aid through the VA at no additional cost if they have a service-connected disability rated at 10% or greater, regardless of what that disability is. So it doesn't have to be for hearing loss. If a person has a 10% or greater service-connected disability for any type of disorder, maybe diabetes, it could be various types of skeletal problems, any type of service-connected disability at 10% or more qualifies for the full scale, the full gamut of hearing aid services. In addition to that, if you've been awarded a Purple Heart, you are eligible. If you are a former prisoner of war, you are eligible. If you are currently enrolled in a VA vocational rehabilitation program, you are eligible. If you have sight or vision problems, and you are about to be admitted or are already admitted into a VA blind rehab center or other low vision programs, you are eligible. You may be eligible if you have significant medical conditions that render you housebound. In that instance, you may file for a special consideration through the VA through what is called an aid and attendance program. And that's provided to veterans who need special assistance. For the most part, I've talked about special considerations, but also the VA has significantly broadened their eligibility for services in the past few years to those veterans who do not have service-connected disabilities. In this instance, if a veteran has a hearing impairment that has resulted from the existence of another medical condition for which they're being treated, or if the hearing loss resulted from treatment for a medical condition, for example, diabetes, they may be eligible for a hearing aid. Or any veteran who has a significant functional or cognitive impairment that limits activities of daily living would be eligible for hearing aids. Any veteran who has a hearing loss that would interfere with the delivery of their health care may be eligible for hearing loss, for hearing aids. Now, in these last ones, it sometimes becomes somewhat arbitrary depending upon the audiologist who is providing the care as to whether or not the veteran meets the guidelines or not. And so in some instances, the eligibility guidelines are very clearly set. In other situations, it's left to the judgment of the audiologist. And so it may vary somewhat from site to site. But the message that I want to leave you with is this. If you have established a service-connected disability for any condition that's 10% or more, then you certainly are eligible for care. But if you haven't been able to establish that, but you are having hearing loss that would interfere with the delivery of health care to you, please don't let that fact that you're not service-connected stop you from seeking assistance. It's very likely that even though you don't have a service-connected disability, that you may be eligible for care and assistance for hearing devices through the VA. So I hope that provides a little bit of a background, and I think probably there may be some follow-up questions to some of these because they have a tendency to be somewhat technical in nature but I'll try to make them as clear to you tonight as possible, or if you wish, you may contact me again at any time through by email. Now, finally, I want to address specifically the issue of cochlear implants. The VA has a very strong cochlear implant program, and most of the larger centers, medical centers in the VA system will offer this service. The medical criteria are very similar to the criteria that are established elsewhere outside of the VA for candidacy for cochlear implants. And those basically have to do with, first of all, no medical contraindications for anesthesia or surgery, no active middle ear disease, and no evidence of eighth nerve disease. Those are pretty much the same criteria that are followed elsewhere outside of the VA. As far as the audiological criteria are concerned, we provide cochlear implants for those individuals who receive only marginal or worse benefits, who have bilateral severe and profound hearing loss. And then there are some technical markstones that a person has to meet in order to be eligible for a cochlear implant. But I think it's fair to say that if a person has a severe to profound hearing loss for which they are receiving minimal or no benefit from traditional amplification, they probably would qualify for a cochlear implant. And finally, if the patient has any cognitive or emotional capacity to adapt and benefit to implantation, that's an important consideration. And also if they have reasonable and appropriate expectations of potential benefit. And of course, we help veterans work through those to make sure that the expectations are real, so that the risk and the benefit from the surgical procedure are properly balanced. And then, of course, the patient must also agree to participate in treatment and in a rehabilitative protocol. That's just like it is anywhere else outside of the VA as well. So I hope that these bits of information that I've provided give you some background to the VA hearing aid program. And again, if you have questions about any of these, I'd be happy to address them this evening if we have time, and if not, just get in touch with me by email. And I think that concludes the brief presentation, Tony. I think if we have questions, I would like to begin, if it's okay with you, with some questions that were already submitted today. I received some excellent questions from Alan, and information this evening that you asked for, but I'll do the best to find that information and to forward it on to you. One of your questions asked if the military tracks the number of soldiers with hearing loss. And although I'm not a military audiologist, I'm quite certain that they do. And I do have friends who are in the military in audiology, and I'll go ahead and contact them in the next day or two to try to answer that question. And then your second question had to do with how does that compare with current DVA estimates of those within the VA health system. And again, I can provide that information for you later on. And you also asked for the breakdown within the VA of mild to moderate to profound hearing loss. Let me say this, that first of all, it's only been in the last 2 years that the VA has had a center for collecting audiometric data. And we've been doing that now for a couple of years, and we've just passed our 1 millionth audiogram. So we have a lot of data, but at this point, we have not had upon my years of experience in the VA, how the breakdown occurs with regard to severity of hearing loss in the VA, with regard to mild, moderate, and severe. I would say that probably in the range of 40 to 45% of the veterans that we see are what we would call mild. Probably 40 to 45% are in the moderate to moderately severe range. Only a small number are in the severe to profound range. And I think that's pretty accurate and pretty stable across other medical centers from the information that I've been able to obtain from audiologists at those sites as well. I think the bottom line is that we don't see the severity of profound hearing loss within the VA that we see outside of the VA. And of course, the reason for that is because all of our profound veterans would have had to have had acquired profound hearing loss, as any profound hearing loss at birth would probably disqualify an individual from military service. So the patients that we see all have acquired hearing loss, and we don't see the incidence of severe to profound inside of the VA that we do outside of the VA. At the medical center that I'm in Nashville, we probably do 4 to 5 cochlear implants a year. So that gives you an idea of the incidence of new severe to profound hearing loss that we see, at least at our medical center. One of the really critical questions that has occurred within the military in the last few years arises from what are called traumatic brain injuries, or and even a subclassification of that, mild traumatic brain injury, where individuals have been exposed to blast exposure, and as such have not actually incurred the type of open type of head wound that are often associated with blast injuries, but rather are sustaining more mild, at least mild appearing types of head injuries, but have very subtle but very real manifestations. One of the real problems that we're seeing now in the veterans coming out of the Gulf Wars is that type of soldier who demonstrates normal hearing in all of our tests, but who simply cannot understand speech under difficult listening conditions such as background noise. We're seeing exactly the same thing in individuals with vision problems who test for vision normally, but who are having problems discriminating images from backgrounds, particularly under difficult situations. And we think that these very subtle types of problems are arising from the results of concussion, brain concussion, not so much exhibiting open head injuries, but the more subtle forms of impairment resulting from closed head injuries. And we're seeing this also not only with regard to vision and audition, but also with regard to the ability of these individuals to attend, to focus, to concentrate, to remember. It's a very much a new area of investigation for the VA, and has almost become the signature injury of soldiers coming out of the Gulf War. So we're very much attuned to those individuals as well. There was a very interesting question that you asked with regard to, I think it was probably relating more to our soldiers coming out with post-traumatic stress syndrome. And you asked whether or not these individuals are experiencing a Kubler-Ross set of stages. And Kubler-Ross is spelled Kubler-ROSS. Those are, of course, the stages of grief that individuals go through, typically when they learn of a devastating illness in their own, that they have themselves, or in a near loved one. And the 5 stages range from initial stage of denial to an eventual stage of acceptance, and then going through the various stages between bargaining and depression, and finally acceptance. And you asked whether or not soldiers who were transitioning, coming out of military, who have had post-traumatic stress syndrome, are going through these stages. And I can't tell you for sure that they are. And I'm not sure anyone knows, but many of them pose many of the same types of symptoms, and that is, we of course would not see them in the initial stage of denial, because that would be immediately following injury. But we do see many veterans in the next stage, and that is either in bargaining or in anger. But what we're very concerned about are veterans in the latter stage of depression. As you've been able to see in the lay literature, depression and suicide are a terrific problem, not only in our nation's veterans, but also in active military. And I think that it's a very plausible explanation that they are passing through some of these stages of grief, particularly if they've been associated with a traumatic injury themselves, or if they've lost a comrade in arms in one of these types of blast situations, and they're now experiencing these stages of grief that are associated with this syndrome. And the VA and the military are becoming increasingly alarmed at the incidence of depression and threatened suicide. I know that all VA personnel who have patients, who have access to patients, who provide direct care, receive regular and updated training on the recognition of depression and suicide, on immediate steps to take in case a veteran threatens suicide. And interestingly enough, one of the conditions that we see, ringing in the ear or tinnitus, is one that's more likely to produce that type of reaction than actual hearing loss, where patients are so depressed by their tinnitus that they just find it difficult to carry on their normal daily activities. So all medical personnel in the VA and the military services are becoming more sensitive, or having sensitivity training in recognizing these symptoms and then making the appropriate recommendation for treatment, and often which includes treatment that very same day, an immediate referral to mental health for an immediate screen. And I know also, as well as being a part of the management of our medical center, that we take suicide threats received by email or over the phone extremely seriously, and all threats are followed up typically by use of local resources, typically area police force or sheriff or state troopers. We take these very seriously. And then you asked that beyond providing technical services, what advice would you give for these veterans and for their families? And the advice that I would provide is to seek, never underestimate the importance of severe depression in an individual who's gone through a stressful period. And by all means, seek the appropriate medical care, either through the emergency room at a VA or other site, or through the outpatient services. Emergency room, if it's a dangerous situation, and through primary care if it's more of a long-term situation. I hope I've given you a little bit of background and some of the information that you desire, and I'll try to find some of the more specific information that you've asked for as well. Tony, I think if you have any other questions, I'd be happy to entertain them now.
Okay, let's see. Can you hear me okay? All right. Okay, I think I'm back on. We did have some people write in, and I'd like to give you those questions if I may. Rufus from San Jose, California says, I'm a veteran of the Korean War. What are the requirements to get hearing aids from the VA at no cost? Okay. So I think you may have covered that.
Let me go back and reiterate. I'd like to cover it again. First of all, Rufus, I want to say that, again, I want to reiterate that in the VA we don't consider it at no cost, because we think you've paid a remarkable cost already through your military service. But I think I understand you to say at no additional cost, no additional expense. What you need to do, Rufus, is go to the nearest VA medical center to you, and you need to go to the business office of that medical center, and you need to enroll for care. You can enroll for care through any VA. Another option, however, that you may wish to take, particularly if you have any, if you've had any injuries while you were in the military that are causing you any difficulties, would be to go to a benefits counselor as well as the business office at the VA and speak to a benefits counselor about filing for a service-connected claim for that disability. I think there's been a lot of talk in the press about how long that process takes, but I think it's not as bad as it used to be, and I would think probably we're looking at a 3 to 4 month delay, but it's well worth it if you have any disabilities that you're experiencing now that you think may have been the result of your military duty. So 2 things. Go to the business office and enroll for care, and then secondly, go to a benefits counselor, and if you have any service-connected disabilities that you would like to file for. There are 2 advantages to filing for these claims. The first is that it may actually result in a monthly compensation check, but more importantly, it places you at the head of the line for care, because the VA does recognize some priority in its resources given to service-connected veterans as opposed to those veterans who have not filed for a service-connected. But regardless, you need to go to the medical center, to the business office, and then to a benefits counselor. Hope that helps.
Okay. Another one from Catherine from Burton, Texas. And she asks, I'm currently attempting to assist my husband with getting some assistance with his hearing loss via the VA. Where is the best place to research documentation for supporting the theory that his loss is noise-induced? He served at 82nd Airborne in the 60s in aviation mechanics, helicopter. We believe that an armory extreme and constant noises without any protection has caused his loss. We are just beginning to try to take advantage of his benefits, so any advice would be appreciated. I'm also hard of hearing.
Well, Catherine, first of all, thank your husband for his service to our country. Really, he doesn't have to provide any evidence if he doesn't have it, because once he files for a claim or asks for care, then it becomes the responsibility of the VA to provide whatever evidence is in the record. And the VA does keep significant, extensive records on veterans, and I know that a number of years ago there was an unfortunate fire at a St. Louis records depository in which some of those records were lost. But most veterans now still have within their VA records their service medical treatment records from their service days, and if you file for that claim, then it's the responsibility of the VA to find those records and to bring them to a VA official to determine whether or not the claim that's being submitted is an appropriate one. But that's for filing a claim. I would suggest that you also go to the business office of the nearest VA and simply enroll for care. Ask for care. Now, there are certain criteria that have to be met, and those criteria are expanding more and more, and I am not an expert on what those criteria are. But if I were you, I would go to the business office, and it always helps to bring a document called a DD-214. That's probably the primary piece of evidence that would be helpful. If you would bring that to the business office and apply for care, then they would be able to tell you whether or not you are eligible and what steps you need to go further into the process. But I would certainly encourage you to make those initial steps either through the business office or through the benefits office of that medical center. I hope that helps.
Okay. The next one here says, Dr. Bratt, I am an Operation Iraq Freedom veteran with severe to profound hearing loss from a suicide bomber attack. From what I have heard, there are thousands, if not hundreds of thousands, of veterans returning home with a hearing loss from blasts. I was wondering what the VA is anticipating as far as funding and utilizing newer technologies as they are advancing rapidly all the time. I believe that once a veteran from the GWOT era is admitted into the system, there should be an immediate and mandatory hearing test administered. Is there a proposal for this in the works? One last quick question. I have heard that tinnitus is the #1 compensation claim for veterans of these wars due to the exposure to blasts, obviously. What research is out there to help address this symptom? And thanks for your time and your participation in this chat. Respectfully, Mark Brogan, Captain U.S. Army, retired. And Mark Brogan is in our audience tonight, so you'll be speaking to him directly. Right. I think you know him,
I
too.
think so. And let me tell you, I think we had a chance to meet in Nashville, if I'm not mistaken. And it was indeed an honor. The number of questions that you ask are very important questions. You are correct. Tinnitus is the #1 condition for which compensation is paid in the VA. #2 is hearing loss. And sometimes they'll reverse position. But between those two conditions, those are the two most commonly rated disabilities in the VA. And so it tells you the magnitude of the issue, not only for our Gulf War veterans, but also for veterans from previous wars. But I will say that the veterans of our Gulf Wars are beginning to demonstrate similar and very remarkably exclusive injuries. And I had alluded to this before, and that has to do with what's called minimal traumatic brain injury. And it's really not minimal at all. It's called minimal because it doesn't have any open wounds that are so impressive in graphic display. These individuals may look absolutely normal, but have suffered concussion. And as a result of that, have very subtle hearing disabilities that are difficult to manage and that we're only really trying to begin to fathom. First of all, let me say that all veterans from Operation Iraqi Freedom and Operation Iraqi from the Iraqi conflicts have been granted, I believe it's now 6 years of open-ended treatment for whatever disabilities they have. Trauma teams. And these teams are multidisciplinary, interdisciplinary teams that are charged with evaluating patients coming in from the Gulf Wars with any type of injury at all. And what they often do then is do a screening for various types of disabilities, and then more intensive training for for disabilities that prove to be positive. So the matter of tinnitus is very difficult to manage. As you know, there is no cure for tinnitus. It's a permanent condition, but that does not mean that we can't help individuals manage them. In the VA, we use a philosophy of progressive management, and that is we try with the simplest forms, and often for many individuals suffering from tinnitus, the fitting of very good hearing aids will provide significant benefit. But for those for whom that's not appropriate, there are different types of masking devices and adaptive devices that will work. And then for those individuals who have intractable tinnitus that simply is providing more of an obstacle than they can tolerate in their everyday activities, there are tinnitus management therapy programs, and typically those are not administered within the VA, but administered in the community, but the VA will provide the support to pay for those services. So tinnitus is a terrific problem, not only with regard to its potential effect upon quality of life, but also in regard to how often it occurs, its incidence across veterans returning from conflict. With regard to other devices, I would think that the VA is providing the most the latest technology, both with regard to hearing devices and assistive devices that's available. And if it's not immediately available within the VA, then also we can procure those services through contract in the community. One thing we are trying to do more and more, and that is we are trying to bring our services closer to where veterans live, rather than making them travel long distance to the large medical centers. We are providing these services in smaller sites, and if that's not available in certain circumstances, we may actually contract to go into the community. So I hope that provides some of the information that you were asking about. I think the basic criteria that the VA utilizes with regard to providing needed services is, what does a veteran need? And if those veterans' needs are available within that medical center, we'll do it. And if not, and if they are available in the community, we will take the steps to provide them in the community. Hope that helps.
Thank you. Neil from Charlotte, North Carolina asks, I am a veteran with hearing loss, and I have the most up-to-date hearing devices. I have an FM system from the VA and a Bluetooth system, and I'm very grateful for all they have done because I know how to use the technology and do so. My question, is there anything available that will do voice carryover, VCO, with a cell phone? Does the VA support any type of TTY devices at all? And should I pursue trying to get something? What would you recommend, TTY home phone and or cell phone? I have to do conference calls on occasion and really need to know 100% what is said.
Is this Neil who is asking this question? Neil, the question Neil, that you asked, yes. Neil, the question that you ask is quite complicated because cell phone technology is evolving with regard to compatibility with hearing aids. At the present time, we're making some significant progress, but I am almost going to have to have a conversation with you privately to determine exactly what devices you have, and then I will go ahead and find the necessary resources to answer your question. If you'll email me at the address on the presentation slide that I have put out earlier tonight, I'll certainly get back in touch with you. And what information I find, I will also forward to Tony so that she can make that available to others who are attending tonight's chat.
Okay, I flipped the PowerPoint back so that everybody can see your email address on the screen there.
I'm glad, Neil, that things have worked.
Okay.
Go ahead.
Okay. We have Tom here, who's in the room, wants to know what accommodation does the VA provide for its hard of hearing patients? Are ALDs available or roomed loops? I'm going to assume that he's talking about when he visits the VA facility.
Right. Most hospitals will not have looped rooms, okay? But most facilities will have available assistive listening devices in their audiology programs, especially in the larger hospitals. So my recommendation would be that if you're going to be visiting a VA medical center, specifically either to visit an inpatient, or if you have services that you're going to be seeking in other services in the medical center, I would recommend that you maybe a day or two before you show up, call the audiology service of that medical center, tell them that you're going to be in the hospital, and ask if they have any type of assistive devices that are going to help you with your visit the following. In many VA medical centers, the waiting rooms are very crowded. It's difficult to hear. even with the best listening equipment. And if you find yourself in those situations, hopefully you can find a sympathetic clerk who will be able to help you. But certainly if you go to the audiology service, they should have assistive devices that you can use while you're in the medical center to carry on your business of your visit, and then return that device as you leave the medical center. I know we provide those services at our medical center, and I would like to think that most audiology services at other medical centers are the same.
Okay, Fred wants to know, the VA wants to tell you that the VA gave him some government hearing aids that are not giving him satisfactory hearing help. Is the VA obligated to issue me hearing aids that will satisfactorily help me? I am deaf in the left ear and severe in the right ear. I am a Korean veteran. Is there any advanced hearing aid technology available at the VA?
Well, I certainly wish that I could tell you that we had devices that would bring you the satisfaction that you desire. But particularly with individuals with severe to profound hearing loss, even the best devices frequently fall short of what our expectations should be given the state of art in other disciplines. So first of all, I certainly can't assure you that we're going to be able to provide a device for you that's going to prove satisfactory. But having said that, if you have received care from a VA medical center with regard to hearing devices, and those devices are not satisfactory, I would strongly encourage you to call that service back, make an appointment. We do this every day for our veterans. In fact, we always tell our veterans when we put hearing devices on them, first of all, recognize that the devices are not going to bring your hearing back to normal, but also that the devices, especially the newer ones, are extremely versatile. And if you feel that the initial fitting was not the best of your advantage, to bring the device back and let us work with you. So I would encourage you to bring that device back to that medical center, explain to them the problems that you're having, and ask for either adjustments to that device or consideration of another device. I will also say that remarkable advances have been made just in the last couple of years with devices. So if the hearing aids that you have are more than 2 to 3 years old, then I would think that it would be very likely that we could provide you with something better than what you have right now. But I also will say that severe to profound hearing loss remains a very frustrating fact of life for you, obviously, as the veteran, but also for those of us who would like to provide a satisfactory quality of life for you.
Well, it seems that we don't have any more questions, although we have a few comments and some good things to say about the VA service. I think that I just would like to add something personal and just to amplify something that you said, and that is, in order to be eligible for the benefits, go for the care. And so I think what that means is to see a medical doctor, an internal doctor, have a physical exam, and follow up. Get your medical care from the VA, and that will qualify you for audiology benefits. And the reason why I know this is that my father served in World War II, and he came to live with me a few years ago, and I took him to the VA, and he was getting medical care. Actually, we went to medical care for a second opinion. And while we were there, we accidentally found out he was eligible to get hearing aids because he was getting the medical care there. So he didn't have to prove that it was related to, his war service or anything. He just had to get medical care at the VA center. So I think that's really important for people to understand.
Tony, and can I just add to what you just said? And that's probably one of the greatest misconceptions about care in the VA, and that is that prosthetic devices such as hearing aids are available only for those individuals who have proven service-connected disabilities, and that's just not the case. I think that most individuals who have a hearing loss in the moderate to severe to profound range would qualify for devices under the criterion that devices are available for anyone for whom their care is compromised by their hearing loss. And what that means is that the VA has taken the position that if we're going to provide medical care for a veteran, then that veteran should be able to participate fully in that medical care. And as you know, most care really is a two-way street. It involves not only the provider, but the patient working together. And to do that requires typically adequate communication skills. And if that's compromised by the presence of a hearing loss, then a patient would qualify for assistive devices, hearing aids, and other devices simply because they are receiving that care. And so the advice that I gave earlier is very real. If you feel that you have a service-connected or service-related disability and you have not filed a claim, do so. And the best way to do that is through contacting a benefits counselor. Now, let me just say something about benefits counselors. Typically, they're highly qualified. Sometimes they're not, okay? And you can find them in many different locations. Most of the large VA medical centers will typically have 3 or 4 such benefits on duty during business hours, Monday through Friday. In our medical center, we have probably 3 or 4, and we have representatives from both the American Legion and the DAV that have permanent offices in the medical center, and you can approach these offices on a walk-in basis. You don't have to have appointments. You simply walk into that office. You tell them, I'm a veteran, I have a hearing loss, or I have ringing in my ears, or I have ear disease, and I think the military caused it, and I want to file a claim. And it's helpful to have your DD-214 form with you when you do that. You can also go to VA officers in regional offices, if you're near one of those. You can also go to service organizations in the community. Again, DAV, American Legion, VFW. Most service organizations have benefits counselors in the community, and frequently these people are excellent. Sometimes they're not, and I think if you are not receiving the care or the attention that you expect to receive, then I would suggest you try another benefits counselor. But I think it's very important to have any type of service-related disability at all to make sure you file a claim for it. Again, not so much for the dollars and cents involved with the monthly compensation check, but rather that it qualifies you for care. If you don't have those disabilities, go to the business office of that medical center and ask for care and qualify, and ask if you qualify for care. Again, I'm not an expert on those criteria, but those individuals are. Sometimes the steps can be somewhat laborious, but they are worthwhile. And as Tony mentioned, once you are enrolled for that care, there is a high likelihood that you would be eligible for hearing devices, even though you don't have service-connected disabilities for hearing or other ear-related conditions.
Okay. I don't think we have time for any more questions. So for those of you that have questions, please make note of Dr. Bratt's email address and email him personally. I'd like to say that this program has been recorded and will be available for playback tomorrow. And Dr. Bratt, I just can't thank you enough for being our first guest. I just appreciate you taking your time, your personal time, to be with us tonight.
Well, it was my privilege. As I said that earlier, and I really mean it. Not only a privilege to be with the members of the HLAA, but also an honor to speak with regard to the VA. I've been with the VA for about 35 years, and I can't think of a better way to have spent my career. And every day is an honor and a privilege to be able to serve individuals like Captain Brogdon.
And I hope you'll come back and see us again sometime.
I would love to. Thank you very much.
Thank you. Okay.